Now, to talk more about tomorrow's budget speech, but focusing on the health sector, we're now joined by member of the Health Committee, Dr. Kgosi Letlape. Good evening, Doctor. Thank you very much for joining us on the late edition. Now, Doctor, most budget previews anticipate a much lower growth forecast, a wider budget deficit, and sizable cuts to spending programs. Given all of this, what would you hope for specifically for the health sector?
Good evening to you. And good evening to the viewers. What I would hope for would have been for the Minister of Health to declare the health sector as in crisis, so that we can mobilize all resources beyond the issue of just the budget. Because once you declare crisis, there can be resources that are mobilized from Treasury to deal with the aspects of what is in crisis in health. And we're hoping that for the first time, the budget will go up commensurately. But more importantly, we're hoping to get a plan from the minister to create government efficiencies. What we need in this country is a dojo of our own, the Department of Government Efficiency. Because even though there are challenges of resources, there's also challenges of the priorities and how we spend the money.
Now, just last week, doctors indicated that they would challenge, specifically in Gauteng, that they'd be challenging the new overtime model that they're now having to deal with, which would see their salary significantly reduced. They work long hours, but what we understood that to mean was that you're going to have doctors on call, but if they're not physically at the hospital where they're called to deal with an emergency, then they wouldn't be paid. So essentially, one would know that today being Tuesday, you are somebody that must await a call, have nothing else to do with your time, but if you are not physically at the hospital, should there be an emergency that needs you, you would not get paid. Now, all of these issues speak to the cost-cutting conversation. It's one that's often talked about, this topic, but one wonders if there can be or should be a conversation around cost-cutting that includes the health sector.
I think before you even get to cost-cutting, it's a challenge when you have a healthcare system being run by people that are not trained healthcare professionals, who are now meddling in how we should operate as healthcare professionals. And that's going beyond their call of duty. What is being done is to undermine the medical profession and other healthcare professionals. What we should be doing is to be paying healthcare professionals on the basis of a total cost to company, not treating them like they are laborers that you find on the street and you count the hours that they work. Healthcare professionals work far beyond the 8 to 4 requirement. And once you begin with a system like this, what you are doing, you are jeopardizing patient healthcare. The healthcare workforce has been totally neglected by government. It's always been prepared to give more than it is paid for, to make a plan, to fill in on the gaps. When you look at the staff establishment of most of the institutions, you don't have enough human resources for the responsibilities of those institutions.
Doctor, you touch on a very important point, that doctors often work far more than the prescribed 8 hours. Now, is that not a danger to their own health? We saw what happened at Prince Mshieni with the intern doctor that lost his life. Is that not a danger to their own lives, but also the lives of the community members that seek their services here? Because there was even one specific intern from the Chris Hani Baragwanath Hospital that went on to indicate on social media that in a month, it was the first time that he was actually having lunch seated down, that generally what has become the norm at these hospitals is just working around the clock. There's not even an opportunity for you to even eat. But then one wonders, beyond just their own physical health, what does that mean when we have just high numbers of medico-legal claims here? The amount of errors that can take place with people's lives if doctors are not well rested, they're so short-staffed. We talk of unfilled posts.
I think as leaders in healthcare, we should take a collective responsibility for what we have created. As doctors, we've been raised on a superhero, superhuman environment, which we are not. So we should take full responsibilities as professionals, particularly those of us that are older, that have created this culture of working ourselves to the bone, and making it an intergenerational abuse of the rights of healthcare. You know, you'll frequently hear us say, oh, during our time, we used to work longer hours. So we, the senior members of the profession, should take responsibility of the harm that we are causing to the profession, and in particular to junior doctors. Because we've allowed the governments to get away with murder by violating our own professionalism, our own rights, and in particular, the rights of junior doctors. So what happened to Dr. Mars? We should take collective responsibility as the profession, as government, and all spheres of government. The executive, the provinces, and all the other areas where doctors are employed. We've treated healthcare professionals, and it's not just about doctors. It's about other healthcare professionals, nurses, pharmacists. Everybody is overworked. Our institutions are overwhelmed. There's no political leadership that takes into cognizance the overload and the overburden of the numbers of people that are being seen in our institutions with human resources that are inadequate. And it's time we stood up for the rights of doctors so that the abuse, the fatigue, and all things are related to insufficient resources, and we being prepared to make a plan.
Yeah, but
and we wonder what we have medical litigation going up, issues. We can't take care of ourselves. We can't take care of our patients, and our institutions are falling apart.
But, you know, oftentimes government would concede that the funds are insufficient, there's not sufficient resources, but they'd also go on to state that the amount allocated to health is always a substantial one, in as much as it's not enough. That if we look at our budget, just numbers alone, it would be health that takes the bulk of the budget, and also the education department. So what of just that response, when at times they say, in as much as they concede that the resources will never be enough, but at least as government they're indicating how important or critical this sector is, that it mostly takes up a large chunk of the budget?
Well, it takes a large chunk of the budget, but most of the budget is not spent on frontline healthcare workers, on patients, on capex, on equipment, on drugs. It's spent on a bloated administration. So we're spending money in the wrong places. And every time there's a budget constraint, you don't reduce administration, you freeze frontline posts. If you want things to work, it should be made unlawful and a criminal offense and a violation of human rights to freeze frontline posts. You go everywhere. I went on an unscheduled oversight to an institution. They have lost 3 midwives that have not been replaced in the last 18 months. They are short-staffed on staff nurses that are needed in that area. They have lost doctors. You need to have on call 2 interns and 2 medical officers. You have a 24-hour clinical health center that's expected to run on 1 intern, 1 medical officer. That's a recipe for disaster. And there is the money from that should be spent in that front line is spent elsewhere. Equipment is not working. ECG machines are not working. You don't have the appropriate drugs to be able to do a resuscitation properly in our facilities. With that huge budget, it's being misspent. Until you have healthcare professionals seriously involved in how the money gets spent, the healthcare system will never work. If you go to private clinics, you don't find admin blocks that outnumber clinical staff. You don't find that.
Doctor, thank you very much for your time this evening. Unfortunately, we have run out of time, but thank you very much for your insights and expectations ahead of tomorrow's budget. That's Dr. Kgosi Letlape speaking to us there.